Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois. We're back again. This time we're going to be talking about more hip pain, specifically hip impingement or femoral acetabular impingement syndrome, FAI. Let's just stick with hip impingement, right? Biggest thing with hip impingement syndrome, when patients talk about they have pain in the front of their hips, specifically it gets worse when they go into a seated position or if they go into a squat. So if you get into a deep squat down here and you feel pain right in the front of those hips, there's a good chance that you have hip impingement in there. So what does that mean exactly? So when we look at the hip joint, very, I don't want to say basic, but ball and socket type joint, right? So you've got the femur that comes up in here, it's got the ball part of it, and then it sits right in that acetabulum. So when you get hip impingement or femoral acetabular impingement syndrome, it's because that ball is not sitting into the socket appropriately. So if we're supposed to be flexing and extending our hip this way, as we flex and it doesn't sit right, you can start to get grinding in the very front of that hip joint right there. Here's the problem. There's a lot of cartilage in there. There's a labrum in there. There's ligaments. Everything starts to connect in there. So as you start bringing that hip up into flexion and that joint grinds and doesn't sit properly, you can start to wear away at the cartilage. You can actually create a tear in your labrum. Muscles are going to start compensating, right? All of our groin muscles and everything, hip flexors, hip adductors all connect up into there. So you can just cause a whole host of problems all because that hip's not sitting right. So we always want to make sure that hip joint's gliding properly. If you do start to get pain in there, one of the things we look at with patients is we take x-rays. We want to see, is there arthritis starting to form in that joint? And if so, then it may be something we need to send out for an MRI, because with those x-rays, what we can see is if you have what's called a cam or a pincer deformity. Basically, all it means is there's two different parts in there, whether it's on the femur or coming off the acetabulum. We get extra bony growth on there that can be adding to that pain and adding to the wearing down of the cartilage in that labrum. So we need to check for those things. Pay attention to these videos coming up this week. We're going to show you everything we do to help these patients get out of pain quickly. If you're watching on YouTube, hit that notification bell, like and follow the page. Facebook, Instagram, like and follow. TikTok, like and follow. We'll catch you guys in the next video.